Great. And then we got one more here, identifying, planning, and preventing risks. And if it happens, then mitigating the consequences. Great. Thank you. All right. So that's great. Thank you, everyone. Now I'm going to tell you how we define it. So to us, we said that similar to some of your answers, risk management is the recognition of risks associated with substance use for individuals and the best route for mitigating those the consequences for these risks. It's another word that we can use, relapse prevention. So we decided to kind of stay away from that word relapse, just given the often negative connotation that's associated with that word. And as you can see, this is like the little blurb that we had in our session, in our module, which says, in general, relapse refers to a return of to old problematic habits. However, we like the term risk management because it is more constructive, and at the core of it, we believe that it's the most important part of people's journey into a new lifestyle, managing the risk of negative consequences from drug use. All right, another Slido. I'm curious, which of these substance use treatment programs are you familiar with? So if you want to go back on Slido and kind of vote for the ones that you know of, so we can see what everyone has heard of, what I guess, and if you're comfortable, you can even unmute yourself or put in the chat if you have experience working with any of these as well. All right, so I see Smart Recovery got 100% there. So everyone seems so far to know Smart Recovery. Some people know contingency. Okay, right. So 12 steps. Yeah. Great. Okay. So it looks like so far everyone who has voted knows Smart Recovery, and then 12 steps is a big part of what people know. Some people know contingency management, and then there is a few people who have others. I'm actually curious what the other programs are that people know, if they're comfortable kind of putting in a chat or again, kind of unmuting themselves and speaking to that, that would be great. Okay, so there is maybe one or two people that know Matrix. And it looks like no one knows Marlette's relapse prevention model. 12 steps, thank you, Richard. Okay, yeah. All right, now we got a tie between Smart Recovery and 12 step. Awesome, all right. Well, thank you everyone for voting. So the module, the risk management module that we created, before actually, it looks like, okay, Breaking Free is right, okay, a program that Sandra mentioned. Yes, that's a big one, and I believe they use a lot of CBT content framework in that one, and then Campus, haven't heard of that one. And constructive alternative to teen suspension preventure. Okay, structured relapse prevention model. Great, these are all great. Does anyone want to unmute themselves and talk about one of these that they've mentioned in the chat before I kind of go into anything? Okay, all right. So, so the risk management module that we created at ACD is informed from Matrix, as well as the relapse prevention model, which was created by Marla and Gordon back in the 80s. So basically both of these models, the Matrix and the relapse prevention, are based on, hugely based on CBT kind of framework and school of thought. But also we also brought in quite a bit of motivational interviewing in our module. And I guess, so a little bit about CBT, if maybe some people don't know much about it. So cognitive behavioral therapy, which, assumes that there's a connection between people's thoughts, feelings, and behavior, and where, someone, as they become more aware of their maladaptive thoughts, they can reframe and replace those with more adaptive thoughts, which will help them to kind of change their feelings around stuff, as well as their behavior, which is the goal here. Okay. And then here, this is basically Marlett and Gordon's model, where an individual is in a high-risk situation, and then they kind of have 2 ways that they could go. So they can have ineffective coping responses, or they can have effective coping responses, and how that would kind of go down the path of, okay, either there's going to be lower self-efficacy, and they're going to see positive outcomes out of their drug or alcohol use, and then which can lead to lapses. And then once they have a lapse, then it's like, okay, well, I already had a lapse. So then they kind of go into a sometimes full-blown relapse. Whereas if they kind of learn those effective coping responses and kind of figure out what are their maladaptive thoughts that they can change, what are the maladaptive ways that they're doing things, and changing that, then it can lead to increased self-efficacy, which will likely lead to decrease probability of having a relapse. So this is a very basic kind of way that they laid out their model. So for the risk management module that we created, it's a self-guided module, so which means that it doesn't need a clinician. It can definitely, it is a module that can be used maybe with a clinician guiding it, but it doesn't have to be. It also isn't a replacement for actual therapy. So we're in no way kind of saying, okay, kind of come to this module and you don't have to go to therapy. No, this is just kind of something that if people are unsure, maybe it's a good place for them to start. And then from there to seek out help and hopefully kind of maybe work through this as they're working with a professional as well. And as we talked about a little bit earlier, our goal isn't abstinence, and we don't think that's necessary, and that's why we called it risk management. The goal is to reduce the risk of the user from drug use. And a big part of what we've kind of put together is accepting setbacks and kind of relapse as part of the process. So if someone has a lapse, that's totally okay. That's totally normal. That happens. No one goes from being abstinent with no kind of setbacks or taking any steps back to all the way to being drug-free for 2 years, 3 years, or lifetime. And then a metaphor that we use throughout this module is climbing a hill. We thought this was really appropriate because, it's very difficult journey, and you need a lot of tools in your backpack to be able to kind of get through this. You can't just kind of have, you can't be barefoot or have the right equipment to be able to kind of do, to go through this process and this journey. And so we decided that climbing a hill was a good metaphor to kind of go with what we wanted people to take away from this module. So the goals of the modules, the module 8 are to be engaging and accessible for everyone. And this is by using inclusive and everyday language and media that's, interactive. And then in terms of the language, we wanted the module to feel like the user was speaking to a friend. So the language is very conversational and avoids negative terminology, such as kind of the word relapse. Like I mentioned, relapse often has a negative connotation. So we stayed away kind of from that kind of language. And then another goal is kind of normalizing setbacks. So again, like I said in the previous slide, setbacks or lapses are a normal part of this process, and kind of really normalizing that and reminding the user that having setbacks in the journey of recovery is okay, and that it's normal to experience. And so really preparing them for setbacks so that the risk when that setback happens is reduced, rather than having it turn into a full-blown relapse. Just because you took 2 steps back doesn't necessarily mean that you need to kind of just drop everything and go back to how you did things before you even started. So kind of really normalizing that and saying that it's okay. In terms of the structure of the module, so each the module has sections, and as you can see, the sections are listed here. So the first section is called Risk Management Model, which is kind of an overview of what risk management means, kind of a little bit, which I talked about earlier, and then having an assessment or a goal clarification for the user of like, what do they want out of this module? What do they want to get out of it? And then the rest of the sections, so starting from high-risk situations all the way to behaviors, are sections that have a psychoeducation, so a teaching concept about that topics, and then 2 to 4 activities, and then following a summary. So for example, in the high-risk situation, the section would start first with a lesson talking about what are high-risk situations. How can you kind of figure out what your high-risk situations are, and then kind of talk, and then have 2 to 4 kind of activities that would kind of hit on what was taught in the psychoeducation, and then a summary. So as you can see, this is there, if you're familiar with CBT, so the kind of structure is very standard of kind of how CBT model works, and how CBT is often used in therapy. And so we really try to kind of bring that here into the online platform. So I guess maybe I'll stop here and see if anyone has any questions before I kind of go through the content. I'll wait maybe a minute or two, see if anyone they want to unmute themselves or just kind of put a question in the chat. And if not, I can just continue going.
Actually, we do have a question on WOVA. So Sandra says, were patients / family members / patient advocates involved in the development of the modules? If yes, can you talk more about this?
Okay, so we're still, so this module is in the early stages of kind of being developed. So we, the way it was developed was by the team at ACD, and we haven't had the chance to kind of really take this out and have feedback from the families of individuals with lived experience or people with lived experience. But that's definitely something that's a big part of what we want to do, and big part of how we want to make sure, because yes, this, all of this content is for individuals who are struggling with substance use. And so big part of that would be to have them involved. But at this point, no, they haven't been involved yet, but that's a big step that is part of the plan. Thank you for that question, Sandra. Yeah,
sorry.
Did you want to read it out?
Yeah, sure. Sorry about that. And Rick was wondering, what about age ranges that has been used in?
So we targeted this for adults. So yeah, so anyone kind of over the age of like 19 or 20, I think would be a good fit for this module as it has been developed so far. We have been talking about kind of creating content for youth, but we don't think that right now, the way module is set, it would be very maybe interesting to youth who are, I guess, yeah, they're engaging in a bit of a different way than adults are. And so we would say that it's for adults, but I don't see a problem with a youth kind of going through this. It just might not be the most interesting for them. Yeah. Great. Is there any more questions, Andrea? Or
Yep. So I'm just checking the chat and the Q&A. I don't see any right now.
Awesome. Great. Thank you, everyone. Okay. So the first kind of section, as I talked about, is called the risk management model. And so here, there's, as I said, there are different lessons within the section. So the first part kind of talks about what is risk management. So what does that mean, risk management? And talking about the fact that risk management is another word for relapse, but we really like the word risk management because it stays away from that abstinence kind of way of looking at things, and that just it's about reducing the risk that is coming your way, or when you decide to kind of start this journey of recovery. And then kind of reminding them that risk management can look different for everyone. So what risk management looks like for you might look different for your friend. And so you can't compare, and everyone has to set their own goals. And then the next section is kind of like, why should I care about risk management? And I included a picture, kind of a screenshot of part of that lesson, which says, as you can, I think it's big enough that people can see it. So it says, changing old habits is hard, but when you have the right tools and support, it can be within your reach. Understanding what can lead to an increased risk of use can help you prevent future use by having a proper toolkit. When we go on a hike, we need to make sure to bring the proper gear to help us get through the difficult parts. What you bring to a hike might be different than what your friend brings to a hike, because we all have different needs. So risk management is important to create your own toolkit so that you're ready when you come across a steep hill. And then even more importantly is how much you value yourself. How much do you appreciate your health, life, and wellness? Remember that you're worthy, and there are people who want you in their life. So it's important to take this time for yourself and set some personal goals for self-betterment. So we really kind of try to include like empowerment and words of encouragement within the modules, the sections as well. We know that it's difficult when you're not interacting with someone face-to-face with a real person. So we really try to kind of bring elements of that into the module, and kind of try to have users who are using the platform and the module to kind of remind them that they're worthy and that people care about them. And this is kind of seen throughout the whole module in different sections. And then, so after this section of why should I care about risk management, there's a section called how do I set goals for substance use. Okay. And then the next section is assessment or goal clarification. So in this kind of section, the user gets to think about what they want to get out of this module by thinking about what's important to them. And then there's some use of motivational interviewing technique here, where we kind of help the user recognize if there's a discrepancy between what they value and how they're currently living their life. And so that will hopefully help them to kind of set goals to change the discrepancy, so that what they're doing now kind of matches their values. The next section is called high risk situations. And in this section, there's a psychoeducation around triggers, which are, social, environmental, or emotional cues that remind you or a person of their drug use. And then there are external and internal triggers. So external would be places, people, and objects, and then internal would be thoughts, emotions, that are related, connected to that high risk situation. And then there's a kind of lesson about seemingly irrelevant decisions. So these are decisions that increase risk of use, but on the surface might not seem related to an individual's drug use. So these are often things that individual would think that they have self-control over, like going to events that there are drugs used or having drugs around them, but thinking that, oh, that's not going to affect my drug use. I'm not doing any drugs, or I've cut down. I have self-control. Oh, in reality, those can really be big triggers. And then in this section, some of the activities are around identifying and then ranking their triggers. So after learning about what are triggers, so what are external, what are internal, kind of having the user go in and think about their own triggers and ranking them. And then also having the user ask their family and friends to identify what the individual's triggers are, and then having the user kind of reflect on that, what they think, what their family or friends said. Does it make sense, or are they surprised around what their family and friends say? The next section is anchors. So understanding what recovery is. So this looks different for everyone. How to start recovery. So the importance of goals. And then how to stay motivated. So social support, groups, keeping busy. And then some of the activities around here is rating how motivated you are to change your behavior. So here, again, kind of using that motivational interviewing of to see where they're at in terms of wanting to change, and then explaining the rating. So why do you feel like you're a 5, and how can we get you to a 7 or 8? And then identifying what can hurt or damage their motivation, or going through pros and cons of staying in recovery. Setbacks. This section kind of talks about, again, the normalization of lapses or having setbacks. And here I kind of included as a part of that section, and you can kind of maybe look through it if you like. And then some of the activities that are included in this section are, so what to do if you do when you have a setback. And so creating that safety plan to put that in place so that when you do have a setback, you can have it and use it. And then thinking about positive moments. So here we wanted to kind of highlight, recognize and highlight that even when there are setbacks, there are good things in your life that no matter how small they are, there are good things happening. And so here kind of taking that more of a strength-based approach to how things are. Okay. Grieving substance use. Here, we wanted to really kind of, make sure that we, again, I'm using this word normalization, but that's what we wanted to normalize, this reminiscing of good times that users have when they were using drugs. And that, okay, yeah, you had good times because that was your life and that was the thing that you got used to. But that doesn't mean that's the only life that you could have. And reminding them, even though you miss your old life, doesn't mean that it was the right path for you, and that you starting in this new journey could be a new start, a new way of doing things. And so kind of really while saying, yeah, that's totally okay to miss your old life, but maybe a new life is a great journey for you. And so the activities in this section are really surrounded around kind of coming up, helping the user come up with new ideas of things that they can do, new hobbies or routines that they can put in place to kind of move forward from their old life that involves substance use. And then the last few sections, so are on emotions, thoughts, and behavior. So emotion has its own section, thoughts has its own section, and behaviors has its own sections. But I've kind of put them together because I think they're very closely related. So this is very CBT based. Because that's a big part of CBT, emotions, thoughts, and behaviors. And so there's psychoeducation around the connection of emotions, thoughts, and behavior, and how that relates to substance use, and then how to address emotion, thoughts, and behaviors that can lead to substance use. So what can you do? How can you cope when you have cravings or urges to use substances? How can you be able to do something if you're feeling sad that doesn't involve shooting up? Or what can you do when you're happy and you want to celebrate instead of kind of drinking? What can you do instead? And so pretty much almost all of the activities in these sections are around coming up with different coping skills to kind of get through different situations, feelings, and thoughts without using substances. And so this is, again, a big part of kind of Matrix and the relapse prevention model of Marlett and Gordon. And then the final section is called Final Thoughts. So this is a summary of all the sections before, and then it has a lesson which is called What to Do if I relapse. And so here we wanted to kind of help the user brainstorm what happened. So what do you think led to this? What do you think happened before you kind of took that shot or smoked that joint? And then kind of really highlighting the importance of reaching out to a professional, whoever that might be. So either a doctor or a mental health professional, or if you have a team who you're working with, really reaching out to them because they can really help you get through this. And then having that empathy of, okay, this is really hard, but also with the encouragement that you can get through this. So I've included kind of a little blurb from that section here. So it says, there's often a negative implication to having a relapse. You might feel discouraged to continue this new journey of yours. But remember, just like hiking, starting a new lifestyle has steep hills, which can be eased by being prepared for them. So if you have a setback or a relapse, don't give up, but check your hiking gear and your map. Maybe you just need to change your path a little. So this was the final section. I'm aware of the time, so I'm just I have one more slide that I'm gonna go quickly so then I can get to questions. So the next steps for this module are creating more interactive media as is, and then as I talked about a little bit earlier, including really lived experiences of individuals with videos and content, and then having it user tested, and really kind of involving individuals and families of individuals who have gone through substance use problems to be part of this process, so we can make sure that it's something that is appropriate for the population that we're creating this for. That's it. I am going to stop my presentation. Okay, so and yeah, so if you have any question, I'll be happy to answer them in this little time that we have.
Yeah, thank you so much, Ava. That was such an interesting presentation. And yeah, we do have a few questions in the chat. So Sandra just has a comment. She says, I get the impression that this module may have a workbook and possibly be available in different formats, so text or audio visual.
Right. Sorry, are you asking if we have a workbook, or are you saying that there's something available already? I guess I can answer. So there is no workbook that we've kind of put together. This module we've created kind of on RAMP, which is a risk assessment management platform that's been in the process of being created by Addictions and Concurrent Disorder Lab at UBC, and this is part of that. Yeah, so it has text and audio and visuals, but there's no workbook with it right now.
Great, thank you. And Rick also asks, how do you define recovery?
Yeah,
that's define recovery. Yeah.
Yeah, that's a great question. So I think something that we really highlight in the module is that recovery looks different for everyone. So for example, if for one person, recovery can look like, you know, being abstinent and not touching any drugs or alcohol. But for another person, recovery at this point means cutting down on their use. And so we really kind of established that from the very get-go, that your recovery and my recovery and your friend's recovery all look different, and it means different things for different people. And so it's really up to you to kind of be clear of your goals and your own journey of what that might look like, what you want it to look like.
Great, thank you. Yeah. And does anyone else have any questions? You can put it in the chat, you can unmute yourself, or ask on WOVA.
So I have the question, probably comment or some. Thank you very much, Ava. So I want also to mention that this is available on RAMP. So the module that you were mentioning is available on RAMP and is currently functioning, so that if anyone wants an access or an account, they can just email Marisha or you, so that we can create them an account and they can go and visit the website and also get access to those modules.
Yes, thank you, Alireza, and hi.
Thank you.